Hey guys, good morning. It's Trevor from SmashweRx again this morning. I got a message yesterday from Jennifer who asked me if I could do a video on frozen shoulders, so that's exactly what I'm going to do today. Frozen shoulder is it's pretty gnarly. It hits about 3 million people at any given time in the US. And what it is basically, and if you've ever had it, you know how painful it is. If you've never had it, you don't want it. So we'll go over some shoulder mobility in a later video. But what it is that the articular capsule of the shoulder, all the ligaments and everything inside a sac that sits around the shoulder, gets all inflamed and it restricts all that motion. And a lot of times it's that external rotation, that extension, that flexion. It's like you hit a stopper and it's excruciatingly painful. And if it's left alone and if you don't get mobility in that joint, the capsule thickens up and it permanently restricts all that motion that you need to do all this, to do everything we do. And since the shoulder is a spheroidal joint, you have this ball that sits inside the concavity of the glenoid fossa. It's part of the scapula. It sits in there, and that's what allows us to move around and do all this stuff and do everything we do with our shoulders. And the dilemma with the human body is you sacrifice stability for mobility. So the more mobile a joint is, the more we can do things, the less stable it is. So we want to make sure that it's strong. We want to make sure that it has full range of motion so we don't get caught up in all these little impingements or hinges, and that there's not a muscular imbalance. So for right now, we're going to go over some frozen shoulder. We're going to fix it, show you how to do it at home, and it's a really, really easy fix. It just takes a little bit of time. And the key is we're going to be doing something called Proprioceptive Neuromuscular Facilitation. It's a big fancy word. I said it the other day when I was doing a wall stretch and a stretch with a plate. But PNF, basically it works on the principle of something called reciprocal inhibition, which basically means that muscles on one side, when they contract, turn off the muscles on the other side of the joint. It's just that simple. It doesn't have to get into anything fancy about muscle spindles or anything like that. But we're going to do this all with a PVC pipe. And as a CrossFitter, we do a lot of things with this PVC pipe. Pass-throughs, stretching, all kinds of stuff. Heck, this is small enough. If you really needed to, you could probably lay on it and roll on it. But what we're going to do is go through all the ranges of motion that need to happen. Adduction, abduction, extension, flexion, everything that we need to do to get this shoulder to free up the way it is. So I'm going to pretend that this shoulder is the one that's frozen, and I have no range of motion. I can't get my shoulder into anything. I can't do any overhead work. I can't even, probably driving even hurts. So this is the easiest way to do it. So the first thing you're going to do is you're going to take your shoulder. I want you to, or you take your PVC pipe rather, and take a knee. So easy. Just take a knee. So if this is the affected shoulder, you're going to come up to a point where you feel that resistance, where you're going to feel that shoulder kick in and where it's going to just not, it's going to say, you're not going anywhere. So you're going to grab the PVC pipe wherever that level is. I don't want it like this. Make sure your arm's fully extended. Take the other hand and put it underneath, because you're going to help yourself walk that arm all the way up that PVC pipe. But before you do that, since we're trying to go this way, you're going to resist going this way. So what you're going to do is you're going to bring it up to that point where you feel it stop. You're going to push down about 5 seconds or so. About 20% contraction. So it's also based on your level too. So if you can contract so hard that you shatter and splinter this PVC pipe into the floor, maybe don't go that much. But about 20 or 30% of your ability to push down against the floor. And it's not this way. Again, that arm's straight out. So this is your trusty friend against the floor. So you're going to push down about 5 seconds. You can use this hand to help yourself walk it up. And then you're going to relax. And then you're going to help yourself walk up a little further. Push down 5 seconds. And then you're going to walk up again a little further. And whenever you get to that new point, you're going to hold that new point for about 20 seconds. I realize that I always say 2 minutes to make a tissue change, but in this case, we're doing things a little differently just because the joint's so inflamed. All right? So you're going to hold this until you get to the point where you just can't do it anymore. And heck, if you can get all the way up here, well then, we've already gotten through a lot of the problems. So that's the first thing you're going to do. The second thing you're going to do is, and I'm going to turn around for this one, is we're going to work on adduction. So that's ADD, adduction. So we're going to work on adding the arm closer to the body, which is the easiest way to remember it. Abduction, adduction, right? So you're going to take the PVC pipe, and I'm just going to go like this briefly, and then I'm going to turn around. You're going to grab it. So easiest way to do it is, in this case, since this is the affected arm, take the PVC pipe, grab it, just bring it up behind you so you can get your hand on it like this so you don't have to reach around and try and fight that range of motion. Because in frozen shoulder, even doing this could quite possibly be really painful. So grab onto that. And what you're going to do is, I'm going to turn around for a second, what you're going to do is your whole goal is to pull that arm this way. Now I did it really fast, but your whole goal is to pull this way, so we're going to be pulling away for 5 seconds. That's the active contraction. That's where we're resisting it, and then we're going to bring that closer to the body to increase that range of motion, okay? So what we're doing is we're pulling this way for 5 seconds. So 5, 4, 3, 2, 1, and then pull a little bit further. Grab that PVC pipe a little closer. Again, pull away. 5, 4, 3, 2, 1. Pull it again. You're going to repeat that usually about 4 or 5 times. You're going to do all of these about 4 or 5 times. We're going to do the same thing in the front, except in the front, we're grabbing open palm this way, not this way. So I want you to externally rotate. Well, it's CrossFit. Everything we do is an external rotation. Wind up that joint capsule. So you're going to do the same thing. You're going to grab this way. Now, in this case, we're doing this. Instead of pulling it closer, we're trying to get the shoulder away from the body. So what way are we going to be resisting? This way. So I'm going to push, 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 5 seconds, and then I'm going to let that go. And grab a little further, push, 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 and then about another 20 seconds. So about 5 seconds of resistance, 20 seconds of holding that new position. And you will come to a point where you feel it stop. And if you can walk it all the way up like this, that's great, but you still have this support right here that's allowing you to not contract the muscles in the shoulder as much as you normally would, so that joint doesn't take a little bit of abuse. You want that inflammation to come down, but the first thing we need to do is get that range of motion in there to allow the fluid and all the inflammatory chemicals and everything to just get out of there. Get some blood flow in there, get that tissue, well, supple again. So there's that one, okay? Now, we're gonna do another one. It's like, the easiest way to think about this is rowing. So same thing, you're gonna grab this way. This hand is the active hand. This hand is the affected hand. This is the affected shoulder again, left shoulder. So, just like a row, you're gonna be here. You're gonna fight pushing forward. 5 seconds, then give it a shove. 5 seconds, and then give it a shove. So now, normally, if you have frozen shoulder syndrome and you can get back this far, we've already done a lot of really good work. But normally, you're gonna be going in such really small increments. So about 4 or 5 times for every range of motion that we've done so far. So there's one last one we're going to do. I'm going to lay on the floor, and it's going to be that external rotation. And this is the one that affects most people the worst. So because you hit this, it feels like you've hit a wall. Like this is in the way, and you've just hit it, and you can't do anything, except associated with that is a lot of pain. So we're going to lay on the ground. Hopefully you can still see me in the camera. I'll come out here a little bit. So we're going to lay down. I'm going to grab with my hand this way. This one doesn't matter this way or this way because the affected arm is this left one. And all we're going to do is we're going to push in. 5 seconds, same thing. And then we're just going to push it out. And I want that elbow anchored to the side of your body. So you're going to push in this way. I'm going to externally rotate. Push in this way, externally rotate. Now, I'm going a lot further than someone with frozen shoulder would be able to do because I don't have frozen shoulder. Let's knock on some wood for that one. So, we've got flexion, we've got extension, we've got adduction, abduction, and we've got external rotation that we've gone through, all using the PVC pipe. There's one more thing you can do, and if you give me a second, I'm going to grab a bench. And don't think because I'm not in the frame, I'm not still here. So we grab a bench. Obviously, frozen shoulder, you wouldn't be grabbing a bench. The bench would already be here. But you can use anything. Coffee table, you can use a chair, you know, you can, here at the gym, you can use a box. I mean, Diablo's got a million different things to use, so this is a great rehab facility as well as the best CrossFit gym around. Take a kettlebell or even a dumbbell, 10 pounds. Kettlebell, really light. And these are called Codman Circles. You're just going to grab the kettlebell and you're just going to do tiny little circles. Get some mobility in that shoulder. You're going to go clockwise 10, counterclockwise 10. Let that shoulder really gap out. And I know that we talk about really sucking that shoulder back into the joint because wound up and sucked in is the most stable portion of the shoulder. However, in this case, I really want you to distract that shoulder. Get a lot of distraction in there, get some movement in that joint. This, and then you're gonna make it plus. You go back and forth and side to side. Back and forth and side to side. That's gonna get some blood flow in there and it's gonna get some movement in that shoulder. You do this for a couple of days, that frozen shoulder isn't gonna be so frozen anymore. So Jennifer, I hope that helps, and I'll smash you later.